deadly flash floods have killed at least 24 people. Right now, a massive search is underway for more than 20 young girls who were attending Camp Mystic, an all-girls summer camp in Texas Hill Country. Some of the missing appear to be as young as 8 years old, and all of this followed a powerful storm that stalled over Kerr County on Friday, dumping more than 10 inches of rain in just a few hours. Now, that triggered a rare flash flood emergency as the Guadalupe River, which you're looking at, rose more than 25 feet almost instantly. The floodwaters trapped people in their cars. It filled homes with water. It submerged entire trees. Governor Greg Abbott called it a, quote, extraordinary catastrophe. And so far, emergency crews have rescued more than 200 people, but the search continues this morning under difficult conditions. Joining me now is NBC News correspondent Ryan Chandler, who's in Kerr County, Texas. Ryan, what a scene we've been watching you cover all morning. Talk to me about what you know now.
Well, the one and only priority in this community right now, Ali, is, of course, finding those missing girls. And I wish we had more information about who exactly is missing. But we know from state officials last night, anywhere from 23 to 25 girls from Camp Mystic are still unaccounted for. And you can get an idea of the destruction, the power that they faced at that camp last night. Looking behind me, this is not a riverbed that you see here. This is a public park, the Guadalupe River, which exploded overnight, leading to all of this destruction and death. That's about a football field away from me. Everything that you see in between, wow. It looks like a tornado rushed through here, but that is not wind. That is the destructive force of water. You see how high the bark was stripped off of these trees. The Guadalupe River rising as much as 22 feet in just the first 30 minutes, getting up to about 30 feet deep. Which was enough to leave a widespread field of destruction, and now at least 24 deaths in this county alone. There's a lot of rumors, online chatter about who these girls are, where they might be, but we have no official confirmation about their identities. What we do know is the search field is about 30 miles long from here in Kerrville, 30 miles down the river where they may have washed away. Right now, people are just hoping and praying that more turn up today.
All right, Ryan, stay with us. Obviously, as you get more news, just wave in front of the camera. As many of you might know, I grew up in Canada. It's where I was raised. It's where I went to school. It's where I started my career. And I lived there for a big portion of my early life. So I can tell you that for all of the similarities that America and Canada have in common, healthcare is not one of them. Unlike the United States, Canada has a publicly funded universal healthcare system. Canada's version is called a single-payer system, the government being the single payer of all healthcare. Each province or territory shares the responsibility with the Canadian government of covering health insurance for every eligible resident. It covers basic, necessary, and preventative care. You can go to the doctor without much of a hassle, though like here in the United States, there is a shortage of doctors in Canada. Or you can go to the hospital for an emergency visit without having to itemize in your head how much every single pill or procedure will cost you. Now, it's not a perfect system. But in general, people receive the care that they need and they don't get stuck with bills that send them into crippling debt afterward. And that's the case for nearly every developed country that's a member of a group that's known as the Organization for Economic Cooperation and Development, OECD. It's kind of shorthand for developed countries. Germany, Ireland, Italy, Japan, Portugal, Sweden, even Luxembourg. They all have universal or near universal healthcare systems. There is, in fact, just one OECD country that doesn't have some version of healthcare available for everyone, and that is the United States of America. The U.S. to this day lags far behind many, many countries when it comes to providing affordable health insurance for its people. Under America's for-profit healthcare system, we spend significantly more money per capita on healthcare compared to other developed nations, sometimes 2 or 3 times as much per person. And the thing is that America's system sometimes produces worse outcomes for all that extra money we pay. Now, that said, America has been making strides toward a better healthcare system for a while now, and a lot of that is due to the social safety net programs that have helped to prevent millions of Americans from becoming uninsured. 60 years ago this month, Lyndon B. Johnson signed into law the Social Security Amendments of 1965. Now, that created 2 critical and popular programs that persist to this day, Medicaid and Medicare. The signing ceremony that you're looking at here took place at the Truman Presidential Library in Independence, Missouri. Former President Harry Truman was in attendance. That's him on the right, wearing the glasses. And moments after the bill became law, The 81-year-old Truman, who was the first American president to propose a national health care program decades earlier, became the first Medicare enrollee. He was presented with his Medicare card. Now, over the years, both Medicaid and Medicare have expanded to cover insurance for low-income Americans, for people with disabilities, children, and the elderly, among other groups. Today, more than 66 million people are on Medicare. 71 million people are on Medicaid. These are state-administered programs that go by many different names depending on where you live. For example, in California, it's called Medi-Cal. There's CanCare in Kansas, TennCare in Tennessee, Sooner Care in Oklahoma, the Sooner State. Texas calls its program Star Plus. In Louisiana, it's Bayou Health. But regardless of the name, this is Medicaid. And the 71 million people who are enrolled in these programs have made Medicaid the largest single insurer in the country today. The Affordable Care Act, what some people familiarly call Obamacare, also helped the country make strides forward, providing health care insurance for more Americans. When the ACA was signed into law in 2010, the country's uninsured rate was 15.5%. In 2023, it reached a record low of 7.9%. As many Americans have experienced firsthand, this country's healthcare system is still far from perfect. It's also undeniable that all of these programs, Medicaid, Medicare, the Affordable Care Act, have led to some progress over the years, progress that could soon be swiftly undone by the One Big Beautiful Bill Act. The GOP mega bill that passed by the slimmest of margins with only Republican votes on Thursday, and yesterday, during the 4th of July event at the White House, Donald Trump officially signed it into law. Despite the GOP's celebrations and promise to cut waste and fraud and abuse, the One Big Beautiful Bill Act will swell America's deficit and lead to people losing health coverage and a decline in quality of care. The Nonpartisan Congressional Budget Office, the CBO, estimates that over the next decade, the bill will add $3.3 trillion to the national debt and could increase the number of uninsured people to 11.8 million. According to the health policy organization KFF, other Trump administration policy changes could actually push that number of uninsured people higher. 17 million people could lose their health insurance. Some will lose insurance because they won't meet the new stricter work requirements and reporting guidance included in the GOP's mega bill. Others will find it harder to enroll and keep their plans under the ACA marketplace. In fact, going forward, people will have to update their information every year. They won't even be able to be allowed to automatically re-enroll, which is just a weird thing in 2025. On top of that, the One Big Beautiful Bill shortens the annual open enrollment period by about a month. These are all just efforts to choke off access to the ACA marketplace that will only make it harder for millions of people to obtain and maintain health coverage. Medicaid enrollees can also expect more out-of-pocket expenses. The bill includes a provision that requires states with expanded Medicaid coverage to charge some enrollees up to $35 for some services. It may not sound like much to you and me, but to some people, that's the decision between seeking health care and not seeking health care. And all of these changes and cuts are going to lead to loss of service, including the possibility that some of the country's 760 at-risk, financially strapped rural hospitals could be forced to close. And that's why some Republican senators like Susan Collins fought for a $50 billion fund for rural hospitals, although that may still not be enough to prevent some from closing. The One Big Beautiful Bill Act is a step backward for the country's healthcare system. For more on this, I'm joined by Dr. Donald Berwick, former administrator of the Centers for Medicare and Medicaid Services during the Obama administration. He's a senior fellow at the Center for American Progress. Also with me is the Democratic Congresswoman Lauren Underwood of Illinois. She's a former senior advisor for the Department of Health and Human Services and helped implement the Affordable Care Act. And she is also a registered nurse. Lots of things to criticize in this bill, but to me, having grown up as a Canadian, and seeing the strides that we've tried to make in America with healthcare, this one worries me the most because it's not just about healthcare if you're on Medicare or Medicaid. It's about hospitals disappearing, healthcare workers disappearing, standard of life going down, life expectancy going down. This is much bigger than payment for health services.
It definitely is. Coverage matters. This bill will roll back many of the gains of Obamacare to the tune of some 16 or 17 million people who will lose coverage. But also, as you said, it's cutting back on the social safety net more thoroughly. Medicare will be cut under this bill. Most people don't realize that, but Medicare will be about $500 million or $1 billion over the next 10 years. Also, the bill and Obama and Trump policies cut back on some of the really important supports to health in this country. The food stamp system, SNAP, is being cut back by 74% under other provisions that Trump has proposed. And states are going to be hurt hard when the patients aren't going to go away when Medicaid coverage goes away. The states are going to have to make up for a deficit, and states are sources of enormous amounts of support to communities and people for housing and food security. It's a devastating bill. The estimate is that when Medicaid is cut, you lose about one life for every 800 beneficiaries that drop off. That means we're going to have 25,000 deaths a year because of this bill, just because of the coverage cutbacks.
Congressman Underwood, this doesn't fall into the category of waste, fraud, and abuse. This is actually about tax cuts that needed to be extended to the tune of more than $4 trillion, and finding ways to offset that by cutting Medicaid. It came up to about $1 trillion in cuts, so it doesn't even offset the tax cuts enough. But the argument is not that Medicaid and Medicare are inefficient. They might be some of the most efficient parts of government programs that are offered to people.
You're absolutely right. They're trying to cut our health care, make more families go hungry, to give billionaires and wealthy corporations a larger tax cut. It's unconscionable the way that the values are expressed in this bill. It's so lopsided. It's anti-American, and Dr. Berwick is right. More Americans will die as a result of this bill being signed into law.
Donald, one of the things, Congresswoman Underwood is a health care provider. This is an issue in rural areas. Whether you or not you're on Medicaid or Medicare, if a hospital, which gets most of its funding through these programs, is forced to close, you literally lose your health care. And if you're getting older in America or you have health problems, you'll actually have to leave some places. You have to move somewhere that's closer to a hospital.
Exactly right. One of the big myths that's been carried forward by the administration is that this affects others, poor people, people on Medicaid who's not us. That's not true. This bill affects us. One of the mechanisms is what you just said. When in a rural community, the only hospital closes or has to cut way back on services, everybody's support gets cut back. And Medicaid, by the way, is a system that serves a tremendous swath of Americans. Yes, of course, the poor, but also 60% or more of nursing home costs are covered by Medicaid. In fact, middle-class families who have spent down to Medicaid levels. When children are, denied access to the food they need or to the health care coverage they need under Medicaid, the cost goes somewhere. Those kids go somewhere, and so everybody gets affected by these cutbacks. It's not them; it's all of us.
Right. The them versus us thing. And by the way, Congresswoman Underwood, lots of Republicans seem to understand this. It's why there was so much pushback by some of them in the Senate and in the House. It's like, this is going to have to get paid for. It's going to have to get paid for in our states, or people in our states are going to lose their coverage. They understand this is a wildly unpopular bill. It's underwater. It's been underwater for weeks in terms of public popularity.
This legislation was never popular. It didn't start out popular, it didn't end popular. The American people know that this is a scam. We call it a tax scam. And what it means is about a quarter of nursing homes in this country are about to close. We will see a collapse in elder care. Our seniors, our elders are going to need to be able to approach end of life with dignity and the high quality health care that they deserve. And yet, Donald Trump and Republicans in the House and in the Senate unanimously supported this bill that is going to gut nursing homes. It's outrageous. And I think that people get seduced by the nuance and the complexity sometimes. At the end of the day, this is the largest healthcare cut in American history, period.
Yeah.
And the American people understand it, and they don't like it.
Yeah, it's both the largest healthcare cut and the largest transfer of wealth from lower income people to higher income people. I want to take a quick break because we have to pay our bills, but I'm going to come former administrator of the Centers for Medicare and Medicaid Services and Democratic Congresswoman Lauren Underwood of Illinois. Congresswoman, the healthcare industry is the top employer in 38 states, and yet there continues to be a shortage of doctors and nurses in this country. Talk to me about how this all fits together. We need to be building healthcare infrastructure in this country, not taking away.
You're absolutely right. Healthcare jobs create good careers. You can support your families. You have a lot of mobility with that nursing license that I have. I can move around this country and, certainly support myself, right? People want these good jobs. However, going to school is expensive. And yet we see in this bill, this big ugly bill, a cut to student assistance, student loans, student grants, student loan repayment programs, all of those things are being cut in this bill. They are choking off the ability to grow and diversify our healthcare workforce at a time when we know that we need more providers. Listen, the current boomers, this generation 65 plus, this is the largest generation we've ever seen enter into retirement and older age, right? And so we need more providers, not fewer. We need more hospitals.
Yeah.
We need more nursing homes. We need more clinics. We need more spaces in our communities offering affordable, accessible care, and that is being threatened with this legislation.
Donald, Medicare and Medicaid have been, despite what anybody said, they've been really popular programs for a long time in America, and yet there is still this psychological opposition to something that sounds like government-funded universal health care. And I remind people in Canada, a single-payer system means the government pays for it. The government doesn't provide your health care. Why is that, and how can minds be changed about this system that universal health care, and there are many ways to go about it. You don't have to do the Canadian way, but there are many ways to go about it. Why is this not a bigger thing in our discourse?
Hard to say. We are the only developed country that doesn't guarantee health care. Let me start there. And
Yeah.
we know that countries that guarantee health care live longer and actually spend less on health care than we do.
Yeah.
About half of our health care remains in private hands. I think it's partly because people confuse government-funded healthcare, government health insurance, which is
Yes.
Medicare, Medicaid, the Veterans Health Administration, highly popular programs.
Yes.
Government-funded healthcare with government-delivered healthcare. We're not talking in this country about government taking over the delivery of healthcare. The hospitals are still there. The doctors are still there. We're talking about a funding system that's fair, equitable, complete, covers everyone, and costs a heck of a lot less in administrative costs. That's Medicare. That's Medicaid. I personally think it'd be great if everybody had that. And they're better systems. They're extremely popular. And it's not a government takeover delivery of healthcare. That's a myth foisted by people who want to line the pockets of the incumbents who are making a ton of money on this current broken system.
But Congressman Underwood, it's a myth that's stuck. There are people who associate, and they call it socialism and all this kind of stuff, as opposed to simply a more efficient way of delivering health care to people at a lower cost with better outcomes.
Well, at the beginning of this segment, you mentioned that in 2023, we hit the lowest number of uninsured Americans in U.S. history. And that is because of a bill that I wrote that allowed for more people to access the ACA marketplaces and to get extremely popular tax credits that lowered their out-of-pocket costs, right? 4 out of 5 people could get a plan for $10 or less a month. That's being stripped away as a result of this new law. And so by the end of this year, millions of Americans are either going to get kicked off their plans or they're going to see their premiums skyrocket. We're moving in the wrong direction. So you're right, Allie. This myth around universal health care has certainly stuck, while also allowing these Republicans to jam through a cut that's choking off people's ability to go and buy health care for themselves.
Do you think, Congressman Underwood, that part of the problem here is that some of these health care provisions in the bill won't take full effect until after the midterm elections? So some people may not experience or witness the changes that we're talking about until more than a year from now. And they're going to say, you guys are all lying about how it's going to affect me. There's something sort of interesting politically about the timing of the implementation of some of this.
Well, some of it, but to this us versus them point, for many Americans, they buy their own health care through the marketplaces, Obamacare, and their tax credits will be ending on December 31st. So they're going to be getting notices in a couple months about how crazy high, how crazy expensive their premiums are about to be. And then guess what? It's going to be reality for so many millions of Americans, just how bad this big ugly bill hurts them.
Thanks to both of you. I appreciate your time. Dr. Donald Burwell.